people's first thought of Planned Parenthood can be commonly and often negatively affected by our society today. Many believe that Planned Parenthood is a not-so-good organization and wonder why we have funded it for so many years. Yet, Planned Parenthood provides many non-controversial services such as STD testing and treatment, contraception services, cancer screening and prevention, pregnancy tests, and even prenatal services. And yet, Planned Parenthood is well aware of their one single controversial issue that creates a problem in our society. But they still provide several different services to people of all different backgrounds, the ability to maintain a healthy lifestyle and get the medical attention they need. Without Planned Parenthood, people, especially those of low income, would not get the access to health care and will pretty much go without and not be able to see a regular doctor. Planned Parenthood goes below standards and uses government funding to support these people and make the ability for them to get health care at a low cost. The three important things I would like you to remember about Planned Parenthood is it provides many essential healthcare services, meets the financial needs of many, and overall prevents problems and issues that will occur without it. The first thing you should remember about Planned Parenthood is it provides essential healthcare services. Some, but not all, people of the pro-life community and Republicans dislike Planned Parenthood because it is associated with abortion. Yet, through government funding, Planned Parenthood ensures that they do not fund abortions and use donations from other communities and private donations to fund abortions. And defunding Planned Parenthood will defund opportunities for people of low income to maintain a healthy lifestyle and get the attention they need. And the goal of Planned Parenthood is to maintain the well-being of people's health. And the percentage of services done by Planned Parenthood versus the amount of services done by abortion is much larger. Stated on the chart of patient care provided by Planned Parenthood affiliate health centers, STD treatment percentage is at 41%, contraception is 32%, cancer screening and prevention 12%, other women's health services 11%, and finally abortion at 3%. Yet not all of Planned Parenthood's clinics support abortions or even give abortions, and the double number of people who went to Planned Parenthood in 2014 doubles the amount of times that they went for pregnancy tests and abortion procedures. Stated by Kelly Sasung of Planned Parenthood Federation of America article, in 1997, Planned Parenthood Federation and others lobbied for the demise of the partial birth abortion ban, and that is proposed legislation that would have made late-term abortion procedure illegal. Although this legislation never came through, it shows the perspective of Planned Parenthood and how most Planned Parenthood clinics do not give abortions and do not see abortions as a good thing. And the second reason that Planned Parenthood is essential is it meets the financial needs of many. It provides essential services at a reduced rate that corresponds to people's financial stability. And the Planned Parenthood even encourage people with no insurance to call them and reach them and find out how they can have low-cost services or free services altogether. And stated on the PlannedParenthood.org website, Planned Parenthood has many payment options available for low-income patients to receive high-quality services regardless of income level, including no cost or even low cost. We accept most insurance plans, including Medicaid and Medicare, and no one will be denied access to services due to inability to pay. Planned Parenthood doesn't judge people on how much money they make a year or their inability to provide for their family and themselves. They just want to help people and make sure they have the same opportunity as others to be healthy and maintain that healthy state. Scarlett Johansson stated at the Women's March, speaking of her clinician at Planned Parenthood, she was compassionate and professional and told me she was happy to treat me regularly for checkups. She said no judgment, no questions asked. Planned Parenthood provided a safe place where I could be treated with gentle guidance. She is one of the countless people whose lives have been impacted by Planned Parenthood in a positive way and helped her financially. The third reason Planned Parenthood is essential is it overall prevents issues that would come up without it being in place. Without Planned Parenthood, many problems would occur, such as lack of affordable health care for people. Many people cannot afford regular health care and depend on Planned Parenthood to help them provide those services for them and their families. And especially mothers who come to Planned Parenthood for children, more than often babies when they are sick and cannot afford to go to a regular doctor's office. Stated by Dana Evans on thecut.com, without necessary and low-cost health care available at Planned Parenthood, Medicaid spending will actually go up for the federal government and taxpayers. In low-income areas where women depend on Planned Parenthood for Medicaid-funded contraception services, many unwanted pregnancies would rise, and which would put a much bigger and more long-term burden on Medicaid spending. And out of 491 counties that provide Planned Parenthood services, 104 of them state that they have no other clinics where people with low-income financial stability will not be able to get health care and would go without. And stated on the 2017-2018 annual report for Planned Parenthood, Planned Parenthood has served 2.4 million patients, provided 9.7 million services, and 1.2 million people reached through education and outreach. These numbers show that there is a clear perspective of people who value Planned Parenthood and uses their services greatly. In conclusion, the main purpose of Planned Parenthood is not to perform abortions, but is to help people maintain a healthy state and provide them services when they cannot provide them themselves. Planned Parenthood has saved lives of many and helped many people financially, and by seeing the new perspective of their services, then you can see Planned Parenthood just wants what's best for people and their health. And with your help, the real purpose of Planned Parenthood can be spread, and more people will be able to go Planned Parenthood because they know what it's actually about. And as the many struggles of Planned Parenthood continue, I want you to remember the 3 important things, which are they provide essential healthcare services, meet the financial needs of many, and prevent problems and issues that will occur without it being in place.
So you said that a big goal for them was to provide care to people with low incomes, and you said that one way they do that is with payment plans, and sometimes it's low cost or no cost. Do they compete with other services who would do that, or is it just with who comes to them? Are they trying to get people to come to them, or is it?
They're trying just to give services to people who do come to them, and they try to provide as low cost as they can. So they're not really competing with other clinics. They're just trying to make sure people get the services they need, but they may lower the prices to help people go.
Is there a certain age group that Planned Parenthood is intended for, or is it all different ages?
They're mostly intended for children, so mothers can bring in small babies to come get care, and it's often used for college students to get contraception, information, and just overall services.
Did you happen to get a percentage of how many teens actually go to that program?
I believe I can